Welcome back to your Smarter Heart University. Remember, callers 866-970-9622, 866-970-9622. Thanks so much for Carol sharing her story with us. The pop quiz may not have gotten through at the end of the break, so I'll repeat it. Which blockages in your coronary arteries, 20%, 50%, or 80%, can be more fatal and cause more heart attacks? Well, most people, logically, I do this pop quiz every single time a new patient walks into the office. Really, the answer is the 20 and the 50% are more fatal. They don't show up on EKGs. They don't show up on stress tests. They don't give you any symptoms, as I was talking about at the end of the break, until they blow up like a volcano and a clot occludes your artery, reduces that blood flow and oxygen. You get chest pain at that point. And we talked about this last week about stress in the heart, Bob. People often think that it's a bad blockage, but they discovered a while ago, and people under 75, about 75% of them have between a 20% and a 50% blockage that becomes unstable. I tell patients, I think I said it last week too, you got two different types of blockages. Concrete over a sponge and tissue paper over a volcano. Doesn't mean it's always tissue paper, but it's something that we use blood tests to determine, or at least we used to until they took it away from us. Point number 2 on our list. If you go to a doctor and you find out that you are moderate to high risk, that's important, and you see your doctor regularly, you need to follow his or her recommendations. You need to see your doctor regularly. That's first and foremost. Why is this important? Well, here's the example that changed my life and my practice forever, that's for sure. And a lot of people around in our hospital will always remember him. He was a 38-year-old salesman. He's a father of 2. He got evaluated for his risk because his father had an early bypass. He was placed on a blood pressure pill. He was placed on a cholesterol pill. Those numbers improved. He had a normal stress test. He never had any symptoms. And what I say next is my next take-home quote to everybody. The famous last words are not, these symptoms, whatever you got, are going to go away. The famous last words are, I didn't come back, doc, because I feel great. I feel good. 2 years later, in passing, I saw him, and just as an aside, I just said, you need to get back in the office. We have new lab tests. I'm going to talk about that as our fourth point. And CAT scans, and Dr. Kaiser is going to talk about that. He had no symptoms when he went into the emergency room. Well, actually, he had no symptoms when I saw him. He promised to come in and get checked out. 2 days later, he presented to the emergency room with just a burning, like heartburn in his chest. That's it. His EKG was normal, like our caller Carol said. His blood work was normal. He got admitted, but 8 hours later, he never made it out of the emergency room and had cardiac arrest, folks. It's a tragedy.
It is, and these are two classic cases of if you're waiting for an elephant to sit on your chest, keep waiting, because both of these patients were young. The patient that we had where we shared that had such a catastrophe, the young, thin woman, Carol, young woman, this gentleman, young man. Coronary disease can happen in young people. It's not as common, say, as in the older folks, but it does happen. And we have to recognize and you have to understand that these folks also had family history. Their risk, if they really understood their risk and followed up with their doctor, maybe we could have avoided this.
Yeah, I guess what disturbs me all the time is, and that's one of the reasons why we formed this whole program, is trying to get that out, that, you don't know anything, and people often come, saying, I'm adopted. And we can actually help, and that's our fourth point about what we can do to kind of prevent this from happening. And you really, most people just say, all right, my dad or my mom or my aunt or my uncle, had a stroke, had a heart attack. It's almost as a matter of fact, and we don't think, could this affect me? Genetically, when we inherit one of these illnesses, it goes back to the old biology, 25, 50, 25. There's a 25% chance that you could get it premature like all of these folks. And there's a lot of times we can do things to be able to kind of manipulate this and either drag it out and stabilize it so that it's much safer. And later on when it occurs, or never, of course, there's a 50% chance that you're going to share some genetic material. If you take 4 kids, this is how it happens, 25, 50, 25. There's a 50% chance, generally between 50 and 70, that something's going to occur. And then there's a 25% chance you can smoke 3 packs a day and go to your nearest fast food chain and nothing vascular is going to happen. And we have these people. Oh, yeah. They're actually protected by fat, and it's an interesting subgroup that's kind of been evaluated. So, the lesson learned from all of these is again, get to it before it gets to you. Think about what you have. Look at your risk. Get that evaluated by somebody who's very good at stratifying into whether you're low, medium, or high, and then go from there. I mean, that's, I think, the hardest issue that we have to deal with is we feel fine until we don't feel fine. Okay.
And that's the whole world of preventive cardiology.
Right.
We're interventionalists. We love working in the cath lab and trying to open these arteries up. That gets us excited. But truthfully, as you say all the time, I'd much rather prevent the heart attack from happening in the first place than treat it while it's happening. The first situation is recognize your symptoms. If something's happening, you have to get it. You have to see somebody and get it evaluated. And the next component is have somebody evaluate your risk and follow up with your doctor. And all that we're doing is, from a risk prevention and stratification standpoint, is to try and prevent these events from happening in the first place.
Yeah, and as I said, we'd love to hear your stories if anybody is out there. 866-970-9622. We have plenty of stories, but I think the listeners out there everybody knows somebody that I dedicated on our Facebook this morning. I said this goes out to anybody who has ever lost anybody way before their time. I mean, that's the worst. That's what affects us the most. And I'm a plumber. You're a plumber. We unclog drains. But it's pretty easy. That's fairly easy to do. The hardest thing is to prevent them, the drains from clogging to begin with. Right. And you're kind of born that way, folks. It's kind of programmed in. People often come in, they say, my dad had a heart attack. My uncle had a heart attack. I'm worried about a heart attack. Folks, vascular disease is a head to toe process. So a stroke, carotid disease, peripheral vascular disease, kidney disease with a blockage in your arteries, they're all fair game. I mean, it's Dr. Kaiser also specializes in peripheral arterial disease, and he'll tell you, we'll have patients that'll come in and their parents will have a heart attack, but they've got a blockage in their leg. And they don't have to smoke. I mean, it's amazing. They'll have these blockages that we have to fix, and it's like all of a sudden in their 40s or 50s, they're walking and they're getting pain in their legs. Right. So it's a head to toe. It's not, while we're talking about heart attacks here today, it's vascular disease. It's preventing wherever it's going to occur from occurring by kind of just looking at your risk and being told, are you low, are you medium, and are you high? You could be low risk and have high cholesterol, and patients come in now. It's one of the reasons why I got really invested into the integrative medicine category. I wanted to kind of look at everything as comprehensive as possible. There's lipidology, where we look at the cholesterol way below just the levels. And then there's integrative medicine that says, hey, you know what? As we said on our first episode about statins not being the holy grail, not being the be all end all of being able to prevent somebody from dying or having a stroke or having a heart attack, we talked about combination therapy. These are things, I think some of us are afraid. I mean, we're all human. We're afraid to know what we might be carrying. We're afraid. We feel fine, and therefore we do not seek to find any, if it ain't broke, don't fix it mentality, right? I mean, everybody out there, I'm sure, is nodding their head right now going, well, that's me. Want that blood test to find out if you have a marker for cancer or Alzheimer's disease or, any of those things that you can do. Pop quiz again. What percentage of women get typical chest pain? 30%, 50%, or 70%? It's really important. And just like Carol asked with the back pain.
More Dr. Scott and Smarter
We'll be right
Heart.
back.